Hello, my name is Anna Mendez. Today I will be presenting a public health analysis of the Restore Protections for Dialysis Patients Act, also known as HR 2199. This presentation focuses on dialysis patients as a medically vulnerable population and examines how this proposed federal legislation addresses access to care, patient safety, and health equity. Because dialysis is a life-sustaining treatment, any policy that affects access to dialysis has very serious public health implications, which is why this bill is important to analyze. The purpose of this presentation is to analyze a national level health policy that is currently making its way through the US legislation process but has not yet been enacted. I will begin by explaining the public health problem that led to the creation of this bill and discussing how severe that problem is. I will then provide a clear overview of the bill, including its name, number, author, provisions, and current status. After that, I will discuss supporters and opponents, possible unintended consequences, and conclude with the public health recommendation and advocacy plan. Chronic kidney disease, or CKD, is a major public health problem in the United States. According to the Centers of Disease Control and Prevention, approximately 37 million US adults, which is about 15% of the adult population, are living with chronic kidney disease. One of the most concerning aspects of CKD is that nearly 90% of adults with the condition are unaware they have it until it reaches later stages. So, by the time CKD is diagnosed, many patients are already facing kidney failure and require dialysis to survive. This makes kidney disease not just a chronic condition, but also a serious public health crisis related to late detection and access to life-sustaining care. Kidney disease and dialysis do not affect all populations equally. Certain groups are disproportionately impacted, especially racial and ethnic minority populations. Research actually that was published in the Journal of the National Medical Association shows that Black Americans are nearly 4 times more likely to develop kidney failure compared to white Americans. In addition, diabetes and hypertension account for more than 70% of new kidney failure cases in the United States. These conditions are more common in underserved communities, which highlights the role of social determinants of health and structural inequalities. Because of this, dialysis patients often rely on heavily on federal protections to ensure equitable access to care. The severity of kidney failure is extremely high. Dialysis is not an optional treatment. So, according to the National Institute of Diabetes and Digestive and Kidney Diseases, most dialysis patients require treatment 3 times per week to stay alive. So, missing or delaying dialysis treatments can quickly lead to serious complications such as fluid overload, dangerous electrolyte imbalances, heart problems, hospitalization, and even death. From a public health perspective, this means uninterrupted access to dialysis is absolutely essential, and even short gaps in care can have life threatening consequences. Research strongly supports early detection and consistent treatment of kidney disease. A major peer reviewed study published in the Lancet emphasizes that chronic kidney interventions can show disease progression, while stable access to dialysis significantly improves survival and reduces emergency hospitalizations. This evidence highlights the importance of strong healthcare systems and supportive public policies to protect patients who depend on continuous care. The bill analyzed is officially called the Restore Protections for Dialysis Patients Act, and it is designated as H.R. 2199. The bill was introduced on March 18th, 2025, during the 119th Congress. The primary sponsor and author of the bill is Representative Mike Kelly of Pennsylvania, and the bill has bipartisan co sponsorship from lawmakers across multiple states. According to the US Congress, this bill has not yet passed the House of Representatives and is currently under legislative review, meaning it is still in the early stages of the legislative process and has not become a law. In terms of what the bill actually does, H.R. 2199 is designated to restore federal protections for dialysis patients. One key reason this matters is that more than 80% of dialysis patients rely on Medicare for coverage, regardless of age. This bill seeks to prevent insurance practices that could limit or deny access to dialysis care and preserve Medicare safeguards that ensure continuity of dialysis treatments. So, from a public health standpoint, these provisions are critical because dialysis patients depend on consistent access to care to survive. This bill is a part of a broader national effort to improve kidney care. Related legislation includes S 2730 and HR 5027, which focus on access, prevention, and research. Together, these bills show growing federal attention to kidney disease as a public health priority. Supporters of H.R. 2199 believe the bill will lead to improved health outcomes for dialysis patients. Although dialysis patients make up less than 1% of Medicare beneficiaries, they account for over 7% of total Medicare spending. So, supporters argue that restoring protection will reduce treatment disruptions, prevent avoidable hospitalizations, and improve quality of life. In the long term, better continuity of care may also reduce overall healthcare costs by preventing emergencies and complications. Key supporters of the bill include patient advocacy organizations, healthcare professionals, and public health groups. The National Kidney Foundation strongly supports legislation that protects dialysis patients, emphasizing that this population is medically fragile and highly dependent on uninterrupted care. These stakeholders believe that patient safety, access, and equity should be prioritized over short term cost concerns. Advocacy efforts around this bill focus on educating lawmakers and the public about the realities of dialysis care. Advocacy organizations use testimonials, public health data, and clinical research to communicate how harmful dialysis disruptions can be. Common communication channels include congressional outreach, public education campaigns, and professional organization support, all aimed at building awareness and support for dialysis protections. Opposition to H.R. 2199 primarily comes from stakeholders concerned about healthcare costs and increased federal regulation. Some insurance and industry groups argue that restoring protection could raise short term spending or limit flexibility within insurance markets. Cost-focused policymakers may also question whether the bill could increase Medicare expenditures, even though supporters emphasize the long-term benefits of preventing medical emergencies. One potential unintended consequence of passing the bill is increased short-term spending. Medicare currently spends over $130 billion each year on individuals with chronic kidney disease and each end-stage renal disease. Expanding or restoring protections could initially increase costs. However, from a public health perspective, these potential costs may be weighed against the ethical and medical consequences of denying or delaying the life-sustaining care for dialysis patients. From a public health perspective, I recommend supporting the passage of HR 2199. The bill aligns with core public health principles, including prevention, health equity, and protection of vulnerable populations. Ensuring uninterrupted dialysis access is essential for reducing preventable hospitalizations and deaths among patients with kidney failure, and the evidence strongly supports maintaining consistent care. My advocacy plan would include contacting elected officials to express support for dialysis patient protection, supporting kidney health organizations, and sharing evidence-based research with the public. Healthcare professionals and patients can also play an important role by raising awareness about the importance of dialysis access and continuity of care. In conclusion, chronic kidney disease and dialysis represent a serious national public health challenge. Dialysis patients depend on strong federal protections to survive. The Restore Protections for Dialysis Act addresses critical gaps in access, patient safety, and health equity. Supporting the legislation reflects a commitment to evidence based public health practice and ethical responsibility. Thank you so much for listening to my presentation. This is going to be the last slide, which is the reference slide, um, formatted in an APA format. And these are all the resources that I used for this presentation. Thank you.